When I created my office, there was a sense of responsibility and a sense of fulfillment that I had. And I knew that it was important for me to make sure that not only am I providing orthodontic care for my patients, but also that I am a stakeholder in the community that I serve. So within my office, we always try to make sure that we have a presence in our community. We want to make sure that we're engaged.
Today's PSA features Meharry and Dr. Brandon Morgan, a dentist whose journey blends clinical expertise, community service, and health equity. A graduate of Meharry School of Dentistry, class of 2013, and currently the owner of Iconic Orthodontics based in Atlanta, Georgia, Dr. Morgan has combined his clinical expertise with a passion for community service and health policy to expand access to quality dental care. My name is Dr. James E.K. Hildreth, and you're listening to Public Service Announcement, the podcast dedicated to making complicated healthcare topics easily digestible for all who listen. This season, Season 2, highlights the enduring legacy of Meharry and the remarkable Meharrians carrying the legacy forward as we celebrate our 150th anniversary. To learn more about Public Service Announcement or to learn more about Meharry Medical College, visit meharry.edu. So, Dr. Morgan, welcome to the show, and to get us started, can you tell us about yourself and your journey in dentistry?
Okay. Well, first, I would like to thank you for having me. It is definitely a pleasure and honor to be here and to share a little bit about myself and my experience since I've left Meharry. I am a native of Atlanta, Georgia, where I was raised by my mother and father, who are in the sciences and also in education. And so, of course, as they would have it, they have been very large or had a major impact on me and my brother, who both have pursued careers in the healthcare professions.
Mm-hmm.
So throughout our childhood, our parents have always sort of emphasized education and exposed us to different science experiences, different educational experiences, even for me, different experiences within the arts. And so I would say that those decisions that they made had a major impact on me and ultimately led me to wanting to become a dentist, which really dates back to, I would say, my middle school years when I first had the opportunity to go to the orthodontist.
Okay. So you've told us about the influence your parents have had on you and your choices. Were there other people when you were growing up that had an influence beyond your parents?
Of course. So I had a couple dentists in my family, uncle and a cousin.
Okay.
At that time, my uncle was working, and I had a cousin that was matriculating at Ohio State University as the only minority in her dental school class. So they shared a lot of experiences with me. My uncle in particular allowed me to come up. He was from Chicago. So he would allow me to come up and spend time with him in his office. So all of those different encounters definitely helped ground me and make me realize that dentistry was a really good fit for me, because definitely orthodontics in particular, it sort of encapsulated all my different interests.
Mm-hmm.
We had the healthcare aspect, the science aspect, and also the aesthetics and art aspect as well. So by the time I spent some time with my orthodontist, it was very clear that this was something that I wanted to do. It was very fitting and something that I could be successful at.
Well, one of the things that's sort of different in your background than a lot of dentists, I think, would be that when you got your DDS from Meharry, you also got a health policy certificate. So why was that of interest, and how's that experience influenced your work and your approach to providing care to your patients?
Okay. Once again, I want to sort of give kudos to my parents. From a very young age, they've always encouraged us to participate in community service and different community initiatives. I was one of those kids that anytime the teacher would present an opportunity over the weekend, if there was a health walk or anything of that nature, I always wanted to volunteer. And my parents always encouraged me to do so.
Mm-hmm.
So that was the root of it. And then as I matriculated through high school and through college, I attended Emory University, where there was a very strong emphasis on community outreach and different community programs. So as soon as I got on campus there, I found many initiatives that I became involved in. I joined a Greek letter organization, which was heavily involved in the community. So that gave me an opportunity to not only get engaged with community initiatives, but also sort of hone my planning skills when it comes to those sorts of things.
Mm-hmm.
So over the years, and then of course coming to Meharry, My life would take me to Meharry, which was a school that emphasized the giving back to the underserved and serving the underserved communities. And so all of those different experiences provide opportunities for me to not only engage, but honestly understand the importance
Mm-hmm.
of giving back and
Mm-hmm.
serving the underserved communities.
Mm-hmm. Wonderful. So you launched a Medicaid orthodontic program at Beautiful Smiles and saw over 2,000 patients. Now, these patients who are on Medicaid often have a hard time getting access to medical care and dental care. So what prompted you to do this, and what did you see? What did you learn from it in terms of making sure everyone had access to dental care?
Okay. So when I finished residency, I attended Howard University for orthodontic residency.
Mm-hmm.
And so when I was finishing up, I was looking into what were my next steps. And the opportunity presented itself to return home to Atlanta to help or actually create a Medicaid orthodontic program for a pediatric office that was there in the city. The name of the office is Beautiful Smiles, which is owned actually by a Meharry graduate as well.
Mm-hmm.
The idea, I believe, was initially presented to him due to the lack of access that these patients had for orthodontic treatment.
Mm-hmm.
And so he sort of needed someone to come in and get the ball rolling and get that program up and running. So I would say it was a monumental task in the beginning because at that time, orthodontics, it's still considered to be a luxury within the dental
Sure.
community.
Sure. Yes.
So a lot of people not only do not know a lot about it, but a lot of people do not have the means to go about
Sure.
receiving this type of treatment.
Mm-hmm.
But I would say the biggest issues in trying to start this program and even giving this care to patients is resources.
Mm-hmm.
Resources are limited, financial resources are limited, providers are limited, and also facilities that are willing and open to provide this type of care to the underserved communities is also limited as well.
And so, Georgia, like many other states in the South, historically has had challenges providing equal care, equitable care in terms of dentistry to patients. So it's based on what you've done and your experiences, what are the broad issues or systemic issues that need to be addressed to solve this problem?
Okay, I think one of the fundamental issues, of course, is just resources. We need more providers. We need more facilities to see these patients. But even more important to that, in some instances, is the social issues that a lot of these patients face.
Mm-hmm.
In my field of work, continuity of care is very important. When we treat these patients, we're looking to treat them for an extended period of time. So it's very important that they're able to commit to treatment for 2+ years. So a lot of the issues that I ran into in Georgia is that a lot of these patients are transient or they have other social issues that keep them from being able to commit to this type of treatment.
Mm-hmm.
So I think there's a need to take on a more holistic approach to the health of a lot of these people in these communities so that we will achieve better health outcomes, particularly in the orthodontic area.
So can you just let the listeners know when you say there's an importance of the continuity of care, can you explain what a typical treatment in orthodontics would look like?
Okay. So in orthodontics, well, first, a lot of our patients come to us for a multitude of reasons.
Mm-hmm.
A lot of people think of what we do as just purely cosmetic or just meeting the aesthetic needs of our patients.
Mm-hmm.
But there are also functional concerns and other things that are very important for our patients, such as speech, being able to chew your food, which leads to poor nutrition and also your overall health. So, of course, our patients present to us with typical issues,
Mm-hmm.
and there's a consultation.
Right.
At that consultation, we take a look at them, formulate a diagnosis or inform a patient on what needs to be done. And we create a treatment plan over the course of however long it takes to achieve whatever desired result we need to achieve. A typical case for a lot of patients may be 2 years.
Mm-hmm.
However, the more complex the case, the more time it does take to achieve the desired result.
Mm-hmm.
But what's interesting about the Medicaid program within a lot of states, particularly in Georgia, is that in order to be approved for this treatment, the case has to be of a certain complexity.
I see.
And most often, this complexity far exceeds the average 2-year time period that's allotted to treat these cases. So that in itself is another issue within the Medicaid system when trying to treat patients in underserved communities.
Okay. So your practice, Iconic Orthodontics, has grown really well since 2021. And I just wonder how your previous experience in caring for underserved patients shaped the way you structured your practice and your approach to patient care.
Okay. Well, I look at my experiences at Beautiful Smiles and developing on that program as one that was incredibly beneficial, particularly in regards to where I am now. During that time, I was able to see a wide range of treatments or a wide range of patients. There's a lot of diversity within that population. And so I was able to hone those skills and actually take on a different outlook on how to treat my patients.
Mm.
One thing I do consider is looking at the total health or the holistic health of my patients and also
Hmm.
the social situations that they have outside of my practice.
Hmm.
Because all of those things at the end of the day do affect treatment and ultimately do affect the outcome from treatment. So that is one thing that I've taken from those experiences. When I treat my patients in my own private practice now, I always look at what's going on in the patient's home. I always look at other concerns that may be present. They may influence the way treatment goes. And that ultimately creates a better experience for my patients and also creates better outcomes when it comes to their treatment.
Yeah, it's interesting you should say that because in medicine, as well as you know, the social context that a
Yes.
patient
Yes.
has influences how well they do in terms of the care they're receiving from physicians. So I think there's a really interesting parallel there.
Right.
One of the things that's really of interest to me is how you've integrated community engagement into your practice. For example, your annual back to school festival where you give backpacks to students and other things like that. So how do you think private practices in general could address broader healthcare challenges? Since you have that, you seem to have done that really well and seems to be an important part of your work.
Right. Well, giving back to the community, number one, has always been something that's been very important to me. Education has always been something that's important to me as well, considering the background of my parents. So when I created my office, there was a sense of responsibility and a sense of fulfillment that I had. And I knew that it was important for me to make sure that not only am I providing orthodontic care for my patients, but also that I am a stakeholder in the community that I serve.
Mm, mm,
So within my office, we always try to make sure that we have a presence in our community. We want to make sure that we're engaged. And I find that to be very beneficial, the more for the morale. My staff really appreciates the opportunities we get to interact with our patients outside
mm-hmm,
of our office and
mm-hmm.
also see the impact that we're able to have that doesn't relate to dentistry.
Right. That's really wonderful. So one of the things that I'm sure, based on my conversations with you here and the things I've read about you, is that you mentor younger professionals and help them along the way. So why is that important to you? Why do you think mentorship is so important in terms of your work and your journey?
So mentorship has always been a part of my life. As a child, I've been mentored by my cousins and uncles in regards to dentistry. And also in college, being a member of my fraternity, we've always had to engage in mentorship, and whether we were the mentor or the mentee. So, and then also my journey into dentistry was not one that was traditional. I definitely benefited from mentorship from others, and I am the product of those that come before me, and I understand that. And so I do feel as though it is my responsibility to reach back and help others. Over the years, I have hired several pre-dental students or recent college graduates that are interested in going to dental or professional school.
Mm-hmm.
I actually just had one young lady, she spent 2 years with me. When she first came to my office, she expressed to me that she was interested not only going to dental school, but she wanted to go to Meharry. So
Mm-hmm.
me and another Meharry sort of took her on our wings. We both hired her. And during that time, we sort of helped her matriculate through the master's program at Meharry. And now she is a first year in the dental school. So those kind of things, those kind of experiences definitely show me that it's worthwhile. And they're a testament that, with the help of others, or our role as graduates and professionals, our role is to reach back and help those get to the same place that we are.
So you have a remarkable journey so far, Meharry, Howard University. You built a great practice in your hometown. But if you were to have a chance to have a conversation with your younger self, say when you were 18 years old, what would you say to the younger Dr. Morgan about lessons you've learned so far?
Right. So a lesson that I've learned up to this point, well, one that has become more apparent to me now as I've been in practice for almost 10 years now is always be genuine in your intentions
Mm.
and be true to yourself. When I created my practice, one thing that meant the most to me, particularly after working in several other offices, was that this was something that I wanted to create and make sure that it represented who I was. So, in everything that you do, what I would say is be genuine. Take some time, make space, and make time to spend time with yourself and understand truly what you desire and what you want to do. And also, with that, understand how you want to do it. There's more than one way to get to where you want to be.
Yes, yes, yes. Well, certainly, I think your impact, even as a young man, has been really remarkable so far. So, what would you hope your lasting impact will be in terms of dentistry in Georgia or access to dental care in Georgia?
Okay. Well, of course, I would love to be regarded as an exceptional or remarkable orthodontist in the area. But one thing that I definitely want, well, two things actually that I want to be remembered. I want us to have an impact. I want to be recognized as a pillar in the community that I serve outside of dentistry. I want to be regarded as office and a doctor that engaged with the community and really put a lot of energy and effort into making the community better. The other thing is I would like to serve as a model for creativity. So that one thing with my practice is that, we are very non-traditional in the way we approach our patient care. We
Mm.
want to make sure that our patients have a great experience. And sometimes traditional methods of providing that care do not reflect that or do not produce that outcome. So I would like to be a model for a non-traditional way of providing patient care or just a model for creativity so
Hmm.
that providers know that sometimes it's best to take a step back, think about things, think outside the box in order to come up with solutions and ways to provide for our patients.
Well, that's very interesting. Can you give us an example of how a traditional approach to a patient issue might be carried out and then how you are doing things differently? I think the listeners would be very interested in hearing about that.
Okay. I would say the best example for me was in the creation of my office. Typically, dental offices they're constructed in a way where the front desk is in a certain area, the patient area is in a certain place, and there's a certain type of interaction that is expected of the patient and the staff.
Hmm.
It was very important to me that my patients felt welcomed in my office and that we didn't take on that traditional culture. So starting with the design of my office, which I spent a lot of time creating.
Hmm.
We made sure that there are no walls between the lobby and the clinical area, no traditional walls. We have all glass.
Mm.
And so I wanted to make sure that our patients understand that, yet this is a professional environment. We want it to be welcome. We wanted to take off the healthcare hat and allow them into that space so that they will understand better what we're trying to do
Mm.
and not feel that divide between them as patients and us as providers.
And how have your patients responded to this non-traditional approach? Do you think that has made a difference for the patients?
I do. They love it. They love it. The community in which my practice sits has been very, very, very supportive of us. When we have new patients come in, first thing that they always say, they express about how they feel when they come into our
Mm.
office.
Mm.
And that's important for me,
Hmm.
particularly with the first meeting. It's important for the patient, for me, to feel comfortable and feel welcome so that as we move throughout treatment, they understand what's going on and they're comfortable with the entire treatment process.
That's really great. So I'd like to end our conversation by giving you a chance to have a call to action. So if you could just give young professionals and maybe students a message who might be inspired by your journey, what would be the message you'd like them to hear?
I would say the message is to pay attention to the mission of Meharry. I think the mission of Meharry to serve the underserved is very important. And if you really spend some time with it, you will understand that it really does take the work of each one of us individually to improve healthcare and do what it needs to do to progress it. And in doing that, as I said before, you do not have to take on a traditional approach. There are many ways to serve the underserved community.
Mm-hmm.
Volunteering, working in politics or policy.
Mm-hmm.
Those are ways. Or even if you have a private practice, taking a step back and making or creating ways in which your private practice can help with decreasing disparities within the healthcare community. As in with my practice, I'm creating a nonprofit to do its job and getting rid of those disparities as well. So, as I would say, take the mission of Meharry serious, understand that healthcare disparities are real, and be creative and intentional in trying to do your part in ridding healthcare disparities.
So I can't thank you enough for taking time to speak with me, and you're really an exemplar of what Meharry is all about.
Thank you. I appreciate
we're all
it.
inspired by you, and just keep up the great work. And again, thank you so much for joining us today.
Will do. Thank you so much for the opportunity. I appreciate it.
Today's myth: Medicaid patients only need emergency care, not preventive or specialty care. The truth: Medicaid patients benefit from the full spectrum of dental care, preventive, routine, and specialty services, which not only improves their oral health, but also prevents more serious and costly health issues down the line. According to Frontiers in Dental Medicine, a study found that New York Medicaid members with diabetes who received preventive dental care had lower inpatient and total health care costs compared with those who did not. Dr. Morgan's work has shown how dedication to Medicaid patients can change health outcomes, strengthen communities, and brings Meharry's mission to life by training healthcare leaders who make a real difference. Thanks for listening to Public Service Announcement. To follow along on the rest of our journey, visit mmc.edu. And please remember to follow, rate, and review this show wherever you get your podcasts.